Hi, I'm Dr. Samantha. I'm a board-certified psychiatric nurse practitioner with over 13 years nursing experience, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC, I'm perinatal mental health certified, and maternal newborn nursing certified. Bleeding is very scary during pregnancy, so many women will head to the hospital to get checked out. Today we'll be talking about everything you should be asking when you go to the hospital to be evaluated for bleeding. So click those like and subscribe buttons and stay with us. When you go to the hospital to be evaluated for bleeding, you need to make sure you speak with a healthcare provider. Make sure they ask you about your medical history, and if they don't ask, make sure you give it to them. This should include any vitamins you're taking, any medications you're taking, any surgeries, and any medical conditions. You want to make sure that they check your vital signs. If your vital signs are not normal, this can indicate part of the issue for your bleeding. For example, high blood pressure could indicate that you're developing preeclampsia and therefore going into preterm labor. You want to determine what your recent activity, travel, and sexual practices were before you go to the hospital and make sure they know all of that. Travel, for example, can indicate that you were exposed to a disease that might be causing the issue. Make sure you know that your last menstrual period and that you tell them that so they know your proper due date. And make sure that they are asking you about stress and diet. All of these factors build up your entire medical profile, which will help them make a more accurate diagnosis. Make sure you ask for blood work. The first thing you want to ask for is an HCG level to determine if you are pregnant. HCG levels will appear in your blood 11 days after you become pregnant. They should rise during your pregnancy, doubling every 72 hours. So when we test your blood for an HCG level, we get a number, and we can determine if that number is appropriate for how pregnant you are or if you might be having a miscarriage. So you make sure you ask them for that blood test. They may try to offer you a urine test that will not give you the number that I'm referring to. Also ask them to check your thyroid, anemia, infection, Rh factor, and progesterone levels, all of which are important reasons that you may be bleeding. Ask the hospital to do a vaginal exam. During a vaginal exam, they can look at your cervix and they can see if it is inflamed. They can also look for discharge, including the color of the discharge, and they can check to see if you're dilated. Now, they may say no to a vaginal exam. You need to ask them to explain this to you and ask them the risks and benefits of doing a vaginal exam depending on what trimester you're in. Please remember to hit the like and subscribe buttons so you can get our latest content. Infection is one of the most common causes of bleeding, so you want to make sure they're checking you for an infection. One of the most common places to check for an infection is your vagina. So in order to do that, we need to take a sterile swab and we need to gather some secretions. That's the liquid that's coming out of your vagina to determine what is there. We can check for bacteria, viruses, and yeast infections. We can also determine if any of your secretions are normal. There is normal secretion during pregnancy, as well as any secretions that might just be semen if you've recently had sex. Additionally, we need to get a urine sample to check you for a urinary tract infection, which is a common cause of bleeding. Based on all of these results, we can treat the infection with the proper medication to help prevent future bleeding or miscarriage. Make sure you ask them to give you an ultrasound. Ultrasounds are a key test to see where bleeding might be occurring. You want to ask them to check to see if they see the sac and the embryo. This is your baby. You want to ask them to check and see if they see a heartbeat. We can see that on ultrasound. You want to know where your baby is located and make sure it is okay. For example, the baby should be in the uterus, not the fallopian tube. If an embryo is in the fallopian tube, this is an ectopic pregnancy and this is a medical emergency. Ask them to look for a subchorionic hemorrhage. Also ask them to check the placenta position to look for placenta previa. Ask to see if you have a placental abruption. This is where the placenta is detaching from the uterine wall. Another type of ultrasound that you can ask for is a fetal stress test, but this can only be done in the 2nd and 3rd trimesters. There are 2 other causes of bleeding. This is sex and hemorrhoids. While you're at the hospital, make sure they check you for hemorrhoids and tell you if you have them and if they look like they have been bleeding. Also ask them to tell you how to treat them. If you recently had sex, ask them if they believe that was the cause of the bleeding. Also ask them if you are allowed to continue to have sex. Before you leave the hospital, you need to ask them clearly what your instructions are. Ask them what to do if you start bleeding again and when you should be coming back or calling your healthcare provider. Make sure they teach you what the bleeding looks like and how much bleeding is normal so that you know when you're at home what to look for. I hope this video has helped you learn everything you will need to ask when you go to the hospital for bleeding during your pregnancy. Please share your comments and let us know what topics you would like to hear more about. Remember to hit the like and subscribe buttons so you can get our latest information in pregnancy, labor, and early childhood parenting. Share this video with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.